Have you just been told that you have cancer, and have you been exploring your options of having treatment privately? If so, you've probably got lots of questions, particularly if you've not used private healthcare before. Now, the first thing to say on this is that NHS cancer care is actually incredibly good, and our treatment outcomes are some of the best in the world. That doesn't mean that you shouldn't explore all of your options. And if you do access private healthcare for some of your treatment, it doesn't exclude you from NHS treatment at any point if you are a regular UK resident. So why do people explore private healthcare? Now, what people often tell me is that by accessing private care, they feel that they're being put back in the driving seat. They feel they have more control of their appointments, things like where they have their treatment and when they have their treatment. Another reason that people choose private healthcare is that they feel they have more time with their consultant and they enjoy the continuity of care. Now, that's something that I enjoy about private healthcare. I get to know my private patients very well because I see them regularly during treatment and they see me each time and not a member of my team. Another reason people tell me that private care is beneficial is flexibility. That's flexibility for them and flexibility for their consultant or care provider. Now, what does flexibility for you mean? Flexibility for you means that you can choose where you have your treatment, and some of the treatments that I offer, such as chemotherapy or immunotherapy, can even be given in your own home. And it means wherever you are in the country, you can access the expertise of the consultant of your choice. There's also flexibility for your consultant. For me, that means that I can choose to treat you at the facility that can best meet your specific needs, whether that's proton beam therapy or access to MR-guided radiotherapy, for instance. Another benefit of private healthcare is ease of access, both to your consultant and access to new treatments as soon as they become available. So my only advice on this is that if you're thinking about exploring private healthcare, it's probably worth a conversation. So find a consultation that you like the look of, ask for a recommendation from doctors that you know already, and have a conversation with them. Arrange an appointment to discuss your options. Private healthcare may be more accessible than you think, but either way, nobody that I know would mind having a conversation with somebody who's just thinking about where they would like to have treatment or what they want their treatment pathway to look like. If in doubt, make that call.